So we're going to move on to step 5 of the evidence-based medicine process and talk about evaluation of both our treatment as well as our overall process in selecting that treatment. So we're going to talk a little bit in general here for a few minutes, and then we'll talk about a few tools that can be used to collect data to actually measure the overall effectiveness of the instruments that we are using. So the first thing to talk about is the need for step 5. And step 5 very much is the time where we're going to reflect on both the overall process and then the effectiveness. So when we go through and assess the overall process, we're just simply going to be asking ourselves the questions on, did we find the information that we needed, right? And were we able to effectively appraise that and then come to a conclusion? And so the idea being, if we struggled finding the information, maybe we need to go back and work on our ability to design clinically relevant questions or our search strategies. If we're struggling with the approval of that, that might lead to us spending a little bit more continuing ed time on reading and appraising literature. And so either way, we want to be not only growing in our knowledge of interventions, but also growing in our knowledge and ability to apply the processes associated with evidence-based medicine. The second component, and the component we'll spend more time on, is assessing the effectiveness of our overall interventions. Now, this is important not only for determining whether or not we are seeing similar effects associated with the interventions as we found in the research, but also to demonstrate the overall effectiveness of our treatment plans as a whole. So you can contribute to the literature by simply collecting effectiveness studies, and basically you're running your own mini case series, whether you publish them or not. But the ability to determine as well as justify our treatment effectiveness is the new age in medicine. And so one of the ways that we go about doing this is by collecting outcomes. And so the main point and objectives for this is to discuss what we're talking about when we talk about outcomes. And so the overarching questions that we're going to focus on is, how do you measure quality of care provided to your patients? So how do we go about saying and justifying the care that we are giving? How do we show that we are a quality healthcare provider? Well, one way you could do that is by showing improvement in your patient. But in that case, that leads to the next questions, right? How do you denote improvement in patient outcomes? How can we go about showing that our patients are in fact getting better? And then finally, the last question is, who do you involve in the assessment of the outcomes related to the patient? This idea of who is best to assess whether or not this patient is improving. And so we'll talk about this idea of how we can go about evaluating the needs of the patient and whether or not we are meeting those needs. So when we talk about clinical outcomes assessment, and this is simply all data collected during the course of the normal treatment procedure. This doesn't need to be something on top of what you already do. In fact, what it should be doing is just documenting the overall progression of your treatment. And these fall into two general categories. The first and most common that you're used to are clinician-based outcomes. And this occurs every time you do a re-evaluation to measure progress. So by definition, with these clinician-based outcomes, the reason they're categorized as clinician-based is because they are generated by and then of most value to the clinician. So anything that you're generating the outcome data for, whether you're measuring range of motion or strength, maybe girth measurements, or even some functional measurements, like a functional balance test or different components like that, the clinician is the one that's deriving the measure. So it involves the patient, but only in the ability of the patient to perform a specific task given to them by the clinician. Patient-rated outcomes now focus on more what's important to the patient and how the patient believes they are doing. And so these are almost always surveys or some sort of questionnaires that can be added to measure the overall effectiveness from the point of view of the patient. And so this provides a different point of view from just our pure clinician-based measures, and gets to describe more of the aspect of activity and disability measures and societal changes that we saw in the ICF model to gauge patient overall health, opposed to simply in the old school medical model of just health of the injury and condition. So when we talk about patient-rated outcome measures, there are all sorts of different patient-rated outcome measures, but we categorize them based off of whether or not they're generic or specific, as well as their length. Generic outcome measures are specifically designed to measure things like health-related quality of life. The idea that health determines a lot of the quality of life that individuals live. And so the idea here is that we have a single instrument that can cover a large amount of populations, regardless of their condition. The short form 12 or 36 are the most common with that, and ask questions about their overall health care. Specific outcome measures now focus specific to either body regions or disease or conditions. And so things like the foot and ankle ability measurement or the lower extremity functional scale are specific to different regions or different injuries associated with that. And so this gives us more ability in the specific outcome measures to detect minute changes that occur as a result, because we are asking questions more designed to differences within a single body region or injury condition note. So we might ask about the ability to walk up and down stairs and identifying individuals with knee conditions, whereas in a global rating of change or generic outcome measure, we would simply ask about whether or not they are able to get around as they desire. Then we classify them based on their length. We have single item patient-rated outcomes as well as multiple item patient-rated outcomes, and they each have their advantage. Obviously, the more questions you ask, the more details and more data you can get, thereby ability to detect smaller changes. But the more time and sometimes the more difficult they are to assess and grade. So there are places for each of these. When we get into this idea of assessing health-related quality of life, which I mentioned briefly earlier, this very much is designed to collect data in the multidimensional constructs that involve health. And so it's going to ask about physical health, psychological health, social health, spiritual health, and economical health. And the idea here is that all of these are important to the patient. And if their health or lack of health is affecting any of these domains, it allows us for interventions and then to track the change of those interventions. And so there are a bunch of different measurements that can be used. Like I said, the short forms 12 and 36 are most common with that. And then you can apply these in serial administration, basically by repeating them at different intervals of time. You can measure change in their overall quality of life related to their health, and thereby capture their global change associated with health. Right. And so we talked about some of these before. These are just a list there. I'm going to go through a few examples now, but basically for each one of these, I would like you to spend some time reading about them. That's what it is. There's not much more to add with these than to simply allow you the opportunity to read about where these areas of emphasis are and about the number of questions. So spend some time looking at that, both for the generic as well as the specific patient-rated outcomes. And so you can see that there are specific patient-rated outcomes for all sorts of different conditions that would be associated with patients that are physically active. And you can use these then to track the specific changes. But we also mentioned that there are these single outcome measures. We can do these everything from our global ratings of change, function, or disability, which are single questions that then ask individuals to rate their change from the last time, either from the last visit or the beginning visit, basically from the idea on a Likert scale from either very much worse or very much better. Right. Then there are all sorts of different things, right? If you think of our numeric pain rating scale, where we ask people to rate their pain out of 0 to 10, that's a single item outcome measure that's patient oriented from the standpoint that the patient is describing their overall pain opposed to the clinician. And so when we get into incorporating these into our clinical practice and how we can use these to then measure the effectiveness of our treatment, we just simply start to incorporate some of these patient-rated outcomes within our normal reevaluation procedures. And so you can start by administering either single item aspects, which is the easiest, where you just, at the beginning of your evaluation, document things like pain or just rating of function in that single item, to incorporating multi-item aspects, both either general or specific, within your initial evaluation. And then you would include that in your electronic medical record to go ahead and document that change over time. And so you could then go back and look at these to see whether or not you are in fact improving patient outcomes. And so if we see that from these patient-rated outcomes, we are getting decreases in pain, increases in function as described by the patient, that's much more applicable and much more meaningful to patients as well as healthcare providers than increasing range of motion or decreasing swelling. The real goal is to get these individuals back to their normal function in life, and these patient-rated outcomes are a good way to go about documenting those changes.